I think imperfection is beauty and imperfection is perfect. We should all get away from this concept of trying to look perfect. As an eye plastic surgeon, what are the options that is available for the clients that we have? This is very personal for me, and this is truly, I believe, for myself and for my clients. Looking refreshed and rejuvenated naturally, near natural, is always good. So there is a lot of curiosity and a lot of discussion among public regarding BOTOX and fillers, and everyone knows about it. But there's a lot of confusion also regarding both.
Things can go terribly wrong with fillers if it is not given by a trained professional or person who knows about the anatomy of the face.
Anything to do with rejuvenation and facial aesthetics of the eye region, it is so very important to get it done in a professional hand, of course, and with an eye plastic surgeon. Yeah.
So the art has to be subtle.
Yeah, and the artwork has to be good.
So a quick question to you.
Yeah.
Do you ever fill your face?
Hi everyone. Welcome to our third episode of Eye Talk on facial rejuvenation and facial aesthetics. I am Fairooz.
And I'm Shaifali. So facial aesthetics is the in thing these days. There are a lot of questions, confusions around topics of facial rejuvenation and facial aesthetics.
And, in the current era where everyone wants to look perfect, in the current era of social media, this has become more important in day-to-day life, irrespective of the age. And that's exactly why, we being in the profession, being plastic surgeons dealing with eye and face, we thought we'll pick this topic up in order to highlight few very important things and few myths and, the informations regarding various aspects of it and various options of it today in this episode. Let's see how we can navigate this.
All right, so I'll start with the first question.
Okay.
Do you think, is it only important to look perfect or look a certain way? What are your thoughts on that?
Well, you know what, Shaifali, I don't think anyone is perfect. I think imperfection is beauty and imperfection is perfect.
Yes.
And it's not just how you look and how your face looks like. Beauty definitely, I believe, and it just comes from within, which reflects on your face. But as far as looks are concerned, you can always look fresh. You can do various things, try and do things to look fresh, take care of your skin, take care of your diet, take care of, prevent UVB radiation, prevent damage to your skin. And there are certain specific stuffs where you can do in order to improve the look. So that is what I believe. And beauty is definitely what you are within, which reflects on your face. Now, coming to the different options of looking fresh, rejuvenating your face. Shaifali, do you want to discuss, as in our profession, as an eye plastic surgeon, what are the options that is available for the clients that we have?
Yes, so we have many options which can help in facial rejuvenation and facial aesthetics. They can be, if I want to categorize this, for people, it can be non-surgical or surgical options. Mm-hmm. So non-surgical options include injectables. The most in vogue terms are BOTOX and fillers.
Fillers,
yes.
Yeah.
So we'll talk about them shortly.
Yeah.
And then we have options for taking care of the skin. Lasers, microneedling, all those stuffs included in skincare routine. So that is another option. Mm-hmm. If we come to surgical options, the surgical options actually include tightening and sculpting the face, the neck,
okay,
and these areas. So these are the options that are available with us.
Yeah, I agree, yes. Yeah, so Shaifali, you spoke about the non-surgical options and injectable specifically. So there is a lot of curiosity and, a lot of discussion among public regarding BOTOX and fillers. And, everyone knows about it. But there's a lot of confusion also regarding both. So what would you want to talk about it?
So I think we should highlight what is a BOTOX and what is a filler, because I think many people take one term for the other or think that everything is BOTOX. For them, fillers is also probably Botox. So let's talk about that.
Yeah, you mean there is a little bit of a confusion between
Yes,
both? Yeah. Right. Yeah. So it's totally different. Yeah. So Botox is kind of a neurotoxin, botulinum toxin, which is commercially available for medical use. Botox is an injection which is given to paralyze the muscle. Okay, so it smoothens out. So the muscles of our face actually gives us the creases, like, it's the contraction of the muscle which gives the creases, the lines. So basically what you're going and doing is you're injecting this neurotoxin, and then it smoothens the face and the skin by taking out the crease lines, the folds and the crease lines. And that is what Botox is about. And that is the aesthetic part of it, but there are functional part of it. Yes. We all know it. So if you have like a twitching eyelid, you have a twitching like this, and that's because of the contraction of the muscle. So that is a functional issue. Some people, it's kind of a disease. So then you go and inject the Botox in that contracting muscle, and again you paralyze it. So, it's not an evident contraction that the patient will have. There can be tiny contractions happening. There can be severe contractions happening in the face, which even affects the, daily quality of life in patients. So that is all what is Botox is. Yeah.
So basically, Botox can be used for cosmetic purposes and functional purposes.
Yes. Yeah.
So if I come to fillers, what is a filler? Filler actually volumizes the skin. It's a substance, like most commonly used substance is hyaluronic acid. So as you said, that Botox is a toxin. Filler is a substance like a hyaluronic acid, which is injected to volumize the skin. So it plumps up the skin.
Yeah, and basically, contouring also,
Yes.
You can contour. So even Botox, although it is very commonly used for the crease lines and stuff, but there are situations where you can actually, the jawline can be made well, where there is the muscle is very prominent. There are some people where the muscles are very prominent along the eyelid margin, even the cheek and the jaw. So you can inject it and flatten out the muscle. So that also helps in contouring. But unlike fillers, which actually fills and it volumizes, and then again it can also contour the facial structure. Yeah. So this is a clear line of separation between Botox and fillers, and it's not the same. It's so very different.
So actually, we have already talked about the indications or when it is given. Can you quickly just summarize the when do we use Botox?
Yeah.
I'll tell about the fillers.
Yeah, right. Yeah. So let us take it into when, how, and what, and what can go wrong. Yeah. So when, as I told you, like we might have these very graceful lines as you age. You can have these lines which we call crowfoot, and these are actually happy lines. I laugh a lot. So, I have so many lines over
Your
here.
entire life story can be seen on
Exactly,
the face.
yeah. So if you laugh a lot, you get more crease lines. So, these crowfoot lines, you have bunny lines. Again, if you laugh a lot, I have a lot of these bunny lines. You can have these frown lines. You can have lines over the forehead. So these are the lines which can be smoothened out by injecting Botox. And how? It's a very, very simple procedure. Like, a patient comes into the clinic, we apply the cream, and cream is to anesthetize, to make that area numb. It's just like a very smooth cream that we apply. We make the patient sit for a few minutes, and then with the tiniest of the needle, you hardly barely know that we will be pricking it, and it's done in the clinic. And there are various points, and it is important. It can go wrong. When you ask me, can Botox go wrong? It can go wrong in wrong hands. Okay? It has to be done in a very professional hands as far as the quantity is concerned, as far as the site of injections are concerned, and as far as the indication is concerned. So these decision has to be taken professionally, and if the decision is taken professionally in good hands, it hardly goes wrong. It.
Yes.
Right? Yeah. So these are the things. Now, what are the side effects? Botox doesn't have major side effects. Okay. But then if the quantity is more or it's given in a wrong side, patient can have, it's basically paralyzing muscle, right? So if you go and paralyze a wrong muscle, the patient can land up with the droopy eyes. They can have dryness in the eye, closure of the eye can be difficult. So these are the things that can actually go wrong. Like if inject a lot in the facial areas without knowing the exact point where to, you can have a deviation of the face because you're paralyzing that muscle, right? So these are the important things that has to be taken care. And I think as a trained professional, the chances of going wrong is very, very less.
Yes.
Yeah, right. Yeah. Do you want to say about fillers?
Yes. So coming to fillers, so if I talk about when it should be given, what can go wrong, and how it should be given. So fillers are given in cases when we need to voluminize the face, right? So we have tear troughs here. Okay, some people have a deep tear trough because of which they can have tired looking appearance. It can also be used for contouring of the face, as you already spoke about, contouring of the nose, contouring of the chin. So that is the indications, if I would say, of fillers on the face. How is it given? It is given in a very simple clinic OPD setting. The patient comes in and we use needles of different sizes, thin needles. They don't pain that much. In fact, some of the medications, some of the fillers come with pre-medicated anesthesia medicines in them. So the pain is anyways less. And what can go wrong? Well, it's so much more dangerous than Botox.
Yes, it is. Yeah.
Things can go terribly wrong with fillers if it is not given by a trained professional or person who knows about the anatomy of the face and the landmarks where the injection should be given. Things, simple thing like bleeding, bruising is okay when we give the injections, but devastating things like if the filler goes inside the blood vessel, it can lead to blindness.
I mean, there are reported cases, but God forbid it. If it just goes wrong when it's injected in the wrong place, if it just goes in the vessel, and for the same reason, it's so very important for someone who's very professional to give it, right?
And also another thing is, one thing is asymmetry. The lumps and bumps can be asymmetrical when we are giving fillers. It's again about the injection and how it is injected. And it just stays for probably 8 to 10 months. So the repeat of injections has to be there. It's not a permanent solution. So those are the things related to fillers.
So fillers are voluminizers, which is commercially available. Another option also that we have, which is natural, is the fat. You take the fat from your own body. It can be from the thighs or the belly fat. We kind of, take it out, and the fat itself can be used to fill these, areas to voluminize your face. So that is another filler that, we use. And I think, Shaifali, something that I really want to say here, because there is a lot of misconception. People get confused between Botox and fillers. Botox and fillers are not the same. It's so very different. And I think from this description that we gave, you probably understand what specifically Botox is, what specifically it is used for, and what fillers are, and what specifically fillers are used for. So there is definitely a differentiation between both.
So a quick question to you. Did you ever fill your face?
Oh, okay.
Be candid with us.
Very honest. Probably not. I wouldn't fill my.
Would you inject?
You mean Botox?
Yes.
Botox. Yes, I might be. Probably the crow's lines. I like it. If it's too much in future, maybe I might inject my crow lines. And the frown lines, in fact, I have injected my forehead here, I am a very expressive person. I've been a dancer and, I really express. So if you see now, if I'm, lifting my eyebrows, there is no crease lines here. I've actually injected my forehead. So a certain situation, Botox, I feel it is safe and I would use that, but I don't think I'll fill my face ever. I won't. It's personal. It's very personal.
So surgical techniques actually hold good in many scenarios.
Right,
Can
yeah.
you just quickly tell us about the surgical options that we have available for rejuvenating the face and periocular area?
Yeah, so certain clinical patient stories. Yeah, most of these patients, they come to us telling that, I have this very tired look. There is a lot of, bagginess under the eyelid and
Drunken look, in fact.
Drunken look, yeah. Men always come, they come and say, like my friends keep on asking me, have you, are you having a hangover? Because, it's completely swollen. So it's not that. It's as the age progresses, there are so many things that changes in the face. And unfortunately, most of the changes happens in the periocular area, right? Eyes is like, first of all, people look at you and eyes is the first thing that you look at. And most of the changes happens here, like a puffy, baggy lower eyelid. You can have this extra fold of skin which is hanging over here. So there are situations, and we have spoken about fillers and stuff where subtle changes can be taken care by injecting, and it's temporary, right? So surgical techniques helps to rejuvenate the periocular area a lot.
Yeah.
Okay, so what we do in surgery is, especially as far as eyelids are concerned, blepharoplasty is the removal of the excess hanging skin, which is age related, and blepharoplasty is the most commonly done plastic surgery worldwide, everywhere. So blepharoplasty can be done in the upper eyelid, and the puffy, baggy lower eyelid can also be treated by surgically taking out those, fat which is sitting in here and seemingly very bulgy. But it's also very important as far as a surgeon is concerned, and my, outcome that I want to deliver to the patient, it has to be very near natural looking.
Yes.
Okay, and you should not be doing anything in excess, because if you do something in excess, again, it's going to have devastating complication. If you remove excess of skin, the patient will find it difficult to close the eyelid even, right? Yeah, so again, it has to be done in a professional hand. And as far as being an eye plastic surgeons, I think we understand the anatomy of the eye muscles, the deeper structures of the eye. So I think it's definitely more safer in an eye plastic surgeon's hand. There are many oculoplastic surgeons in India and abroad, and I think, anything to do with rejuvenation and facial aesthetics of the eye region, it is so very important to get it done in a professional hand, of course, and with an eye plastic surgeon, yeah. And other surgical things, well, sometimes it's all about gravity, as you age, everything kind of sags down, the skin, and even the brow can sag down. When the brow sags down, it can look as if, your entire eyelid has kind of so
look tired. Actually.
You look tired, and so we can do something like a brow lift, and there are different techniques of lifting the brow. Then, you have mid-face lift, then you can have face lift, you can deal with the neck, So there are various surgical techniques which will give you an overall fresh look. So we don't call it as a cosmetic surgery. I think, we should change the term to more of a rejuvenation and looking fresh in face. And it's definitely possible, yeah.
So essentially what we are doing is tightening and sculpting. Because we're taking up the fat in some areas, we're tightening the skin.
Yeah, right. Yeah.
So the art has to be subtle.
Yeah. And the artwork has to be good. In the hand of an artist.
Trained artist.
Yeah, right.
All right. So we talked about the cosmetic indications of the surgeries. Do you think, are there any functional indications? Do people in their daily life have any functional problems for which they need the surgeries?
Very good question, and it's a very valid question. So as the age progresses, there are so many changes that happens which can functionally affect a patient. You can have a droopy eyelid, a lot of excess of skin, which can actually cause a hooding, and that affects the vision of the patient.
It's like shutter being.
Yeah, so eyelid is kind of a window to the world, So if the eyelid is down, droopy, the skin hooding down, it causes a visual issue for a patient. And there is kind of a frequent, headache and brow ache, which can be associated with that. Another thing is, when you have a hooding, like the field of vision, when you have a hooding of the skin coming here, even the field of vision in this side is very, very obscured. So when it's old age, the vision clarity is so important, because there is a risk of fall.
Yes.
And those are much higher issues in life.
Yes.
So correcting these, droopy eyelids as the age progresses, the excess of the skin, which is a functional visual issue to this patient. So definitely, and I think majority of the patient who undergoes blepharoplasty, and this is even seen abroad in, when I was doing my training in United States, majority of the patients in the facial aesthetic clinics are older age group patient who is coming in for the functional issues that they have.
In fact, this should be done before the cataract surgery.
Actually, yes.
Because the cataract surgery will clear your vision. But what about the shutter that is in front of your eyes?
That is the eyelid,
If you don't lift that up, the vision will still not get clear.
So there is definitely a functional component to it, more than looking good.
So they say you should age gracefully. Do you think aging gracefully and doing all these things can go together?
Well, you know what, Shaifali, yes, aging gracefully at every point of your lifetime, I think grace is the most important thing that you should have. Adding these things to look more fresher doesn't take away the grace from you, right?
Yes.
Grace is just not the face. Grace is the overall, how you carry yourself.
Sure.
So there is a lot of do with grace in an individual. So, doing what is essential to look fresh and rejuvenating yourself, I think it is justifiable. Some people have this thought block, oh no, doing Botox might change your face. But yes, anything which is done, be it a Botox or a filler, excessively, definitely is not good. And I think, we should all get away from this concept of trying to look perfect. And as I initially mentioned, imperfection is beauty, right? So getting a fresh look naturally, I would say, and this is very personal for me, and this is truly, I believe, for myself and for my clients, looking refreshed and rejuvenated naturally, near natural, is always good, and it is really bad to get addicted to it. And especially, getting all these things done in a very younger age group, I think I would avoid it,
that's what I would also like to include, that beauty, I think, doesn't have a template.
It doesn't.
I think it's very personal, and I think it should be taken in that stride.
And you know what, I think we're all beautiful in our own way. It's just not about how we look and how our faces, our eyes or lips are. I think beauty has got a lot to do with what you are inside and out. And that's what we believe, even as a plastic surgeon. But we are here to take care of your facial rejuvenation and facial aesthetics. Thank you for being with us. Thank you.
Thank you. See you soon, guys.
See you soon.